Hey, welcome to the 2025 Clarity Presentation by United Healthcare. Today we will be speaking about Original Medicare a little bit, and then we'll go into a slight difference between Medicare Supplement and Advantage, and then we will go into a little deeper into the Medicare Advantage program. All right, I am a licensed representative with United Healthcare, and I am here to help you navigate through your Medicare options. I am with Legacy Insurance Group. We are contracted with United Healthcare, and we've been selling United Healthcare products for about 12 years, and we are currently serving about 800 local United Healthcare members, certified to sell various Medicare plans, as you can see there. Medicare Advantage, dual special needs, chronic condition plans, and Medicare Supplement with prescription drug plans. Alrighty. Our agenda today, as you can see in bullet points there, we're going to get started with Medicare. What's the right plan for you? We're going to talk about eligibility and enrollment details, the enrollment calendar, when you can enroll, prescription drug coverage, getting to know the important Medicare Advantage information, key information and resources, the right plan promise, and how your agent can help you. As agents, we are dedicated to you. There's no charge to have us help you. You have a licensed professional an earshot away that can help you navigate and can answer questions going forward. So it's a good idea to grab an agent when you can. All right, let's talk Medicare coverage really quick here. Step one is to enroll in Original Medicare. Typically when you turn 65 and you've worked 10 years, which is 40 quarters in the United States, you will get Medicare Part A at no additional cost. You will also have access to Medicare Part B. If you are working and you don't plan on using Medicare, you can hold off on your Part B. Otherwise, when you turn 65 and you're not working or you don't have any additional coverage, you may want to consider picking up Part B. Part B does have a premium, and we'll speak more about that. All right, now that you have Medicare Parts A and B, let's talk about step two, additional coverage, okay? Option one would be to pick up a Medicare supplement plan to pick up costs that your original Medicare does not pick up. So you have co-pays, co-insurance, and deductibles that come with your Medicare Parts A and B. Well, your Medicare supplement plan will pick up those costs, but you will pay a monthly premium for the supplement plan to do so. And if you go that option, you will also have to pick up a standalone prescription drug plan. Now, the Medicare supplement plan and the prescription drug plan are sold by private insurance companies like United Healthcare. Or you can go with option two, which is to add a Medicare Advantage plan, which is also sold by private insurance companies. Now, the difference between option one and option two, we talked about option one. Option two, the Advantage plan, is like an all-in-one plan. You're going to put your Medicare A and B card, your red, white, and blue Medicare card away, and your Medicare Advantage card will become your primary insurance. It will encompass your Part A benefits, your Part B benefits. It will also have a prescription drug plan in most cases, as well as some additional benefits like dental, vision, and hearing. And then let's talk about what's most important to you. When it's time to decide on the option that will make the most sense, there are certain things that we always consider. And some of the questions that we like to have answered is a lower monthly premium and pay for care as you need it. Is that the direction you want to go? Access to your current doctors, additional benefits not covered by Original Medicare, the dental, vision, and that kind of thing. And it's a plan that works with your veterans benefit. All right, so you can also, we talk to veterans all the time, you can have a Medicare Advantage plan in your wallet. Even if you go to the VA, you do have these additional benefits, right? You can go see a civilian doctor. You can go to a dentist and have some dental credits in most cases. and you just have the option to go either way. So it doesn't hurt you to have it. There's no monthly premium or very low, depending on the plan that you select. The Medicare Supplement Plan, you'll have a monthly premium, a little bit higher. I mean, some Advantage plans have premiums, but either they're very, very low or you won't have it at all. Supplements, they'll be a little bit more. I mean, you're talking maybe if you're just aging into Medicare, maybe you're $100 or so a month, and it can kind of go up from there. Access to any provider who accepts Medicare. That's a big one if you travel, or if you like to just have that freedom. Any doctor, any hospital across the United States. No authorizations, no referrals. I mean, pretty wide open. Do you need to add drug coverage with a Medicare prescription drug plan? If you go with the Advantage plan, the drug plan in most cases are rolled in there with no additional premium. If you add a prescription drug plan to your supplement, you're going to pay a standalone prescription drug cost. So you have the Medicare supplement premium, right? You have the prescription drug premium. With the Advantage plan, no premium, and they're both rolled in. So if you pay as you go, it can be a little more affordable in this regard. Dual special needs plans, coverage to supplement the benefits that you get from Medicaid, right? So you have your Medicare Parts A and B, and if you qualify for Medicaid, there are plans specifically designed for people with dual special needs. We call them dual plans. And the benefits are very comprehensive over and above what you get from Medicare and Medicaid. And that's something that I would definitely look into if you have both Medicare and Medicaid. We also have chronic condition plans for folks that have diabetes and cardiovascular disorders, and those are called chronic special needs plans. Those plans, a lot of times you can enroll in most of the year, even when you're outside of open enrollment. Having the special needs is what we call a special election to get you in one of those plans. So talk to one of our agents about that if you think that would benefit you, because there are some benefits to those plans if you have diabetes or cardiovascular disorders. All right, let's talk about your eligibility. To be eligible for Original Medicare, that's A and B, you must be a U.S. citizen or a legal resident living in the country for at least 5 years in a row, including the 5 years just before applying for Medicare. And you must meet one of these criteria. 65 years or older, you can be younger than 65 with a qualifying disability, any age with a diagnosis of end-stage renal disease or ALS, Lou Gehrig's disease. I mean, these are ways you can get into Medicare, A and B, okay, Original Medicare. All right, when can you enroll in a Medicare Advantage plan or prescription drug plan now that you have Original Medicare? Let's talk about the different ways. So your initial enrollment period is the 7 months, including the month that you turn 65. So the 3 months before turning 65, the month of, and the 3 months after your birthday, right? If your birthday is on the first of the month, then your IEP, your initial enrollment period, is determined as though you were born the month before, okay, turning 65. During this time, you can enroll in Original Medicare Parts A and B, and a Medicare Advantage plan, and or a Medicare Part D without penalty. Yes, there's penalties involved if you do not enroll in Medicare when you are supposed to. And a lot of times these penalties do not go away. These penalties stay with you for life. So then, you need to make these moves when you need to. And again, reach out to us if you have any questions or you'd like us to help you. We'd love to help you. Again, missing your IEP is costly. We just talked about the penalties. A, B, and D. All right. Annual enrollment period. We're brushing up against that now, at the time of this video. That is October 15th through December 7th. If you have Medicare Parts A and B, you can enroll in a Medicare Advantage plan. If you already have a Medicare Advantage plan, you can switch your Medicare Advantage plan at that time. And here's something that I want to make very, very clear. If you enroll into a Medicare Advantage plan during your open enrollment, let's say October 15th, the very first day you enroll in the plan, and then you find out a week later you'd like to, dang it, I should have got it into a different plan. You can change your plan as many times as you like between the October 15th and December 7th. right? And the last plan that you enroll in will be effective January 1 of the following year, all right? And you don't have to call the previous plan and let them know that, hey, I changed my mind. The minute you enroll in that next plan, the prior plan disappears, it's gone, all right? So let's say you got your plan, let's look at the middle piece here. So you got your plan in place, January 1 rolls around, and you have between January 1 and March 31st to make one more move with your Medicare Advantage plan. And this is very, very good that they did this. This wasn't always the case. So January 1, you have your shiny new plan, you're gonna use it for the first time, and then you find out it's not what you wanted. Your doctor's not in network. Something's wrong. I thought we checked the doctors, but he's not in there. I don't like this. It doesn't have what I thought it had. So you have one more chance to change your plan between January 1 and March 31. And then, or you can go back to original Medicare at this point. You say, hey, you know what? I don't think I wanted a Medicare Advantage plan. I'm thinking about just going back to original Medicare, or I want a supplement plan. If you want a supplement plan, you can't have both. You can't have Advantage and supplement. If you want a supplement, you have to have original Medicare as your primary, and then you can pick up a supplement plan as your secondary. And you can also, once you get back to original Medicare, you can then enroll in a Part D plan as well. And there's an election period for disenrollment and some other things, but just know at this time we can help you with that option as well. And then April through August, the end of August, is the special election period, all right? You're losing coverage. You move out of a plan's service area. You qualify for extra help with Social Security. Extra help helps you with your prescriptions. You qualify for state Medicaid. You're diagnosed with a certain chronic condition. You can get you on a special needs plan. These are ways that between April and the end of August, we can get you on the plan. Otherwise, it's a lock-in period. If you don't have a special election, the plan that you chose, once March 31 runs out, you had two chances. You had an open enrollment, October through December. Then you had January through March to make one more move. Then you're locked in till really the new year, where we do open enrollment again in October for that following year. All right, let's talk about prescription drug coverage. This slide and this topic is very, very important. I mean, there's been some major changes because of the Inflation Reduction Act. A lot of the changes are helping Medicare beneficiaries with the Part D. And there's 3 stages now: annual deductible, initial coverage, and a catastrophic stage. If you've had Medicare Advantage in the past, you realize there was a donut hole before, or a coverage gap where you're paying higher than normal co-pays and co-insurance. That is gone going into 2025, so very helpful. So you have your annual deductible where you pay 100% of the cost of the drugs. Typically, you're paying about $450, let's just say. In some cases a little less, some cases a little more. $450 up front, that's what you pay. The plan pays nothing at that point, and it varies by plan. The next stage, your initial stage, you're gonna pay a copay or co-insurance for the different tiers. Depending on which tier your drug in will determine how much cost you have. The balance is paid by the insurance company. So you pay $5 for a tier 2. Obviously the drug costs more than $5. The plan will pick up the difference, okay, in this stage. Now, once the total out-of-pocket costs reach $2,000, okay, that is a lot lower than what it typically was in the past. A lot lower. I mean, $2,000 max. I mean, I got clients that hit that in 2-3 months. So you do have that threshold. So if your copays reach $2,000, you will exhaust that stage and you will go into the catastrophic stage where there will be zero for you to pay in the catastrophic stage until the end of the year. Now, something not mentioned here is you also have payment programs going into 2025. So if your costs are going to be very, very high, you can actually speak with the plan and they can put you on a payment plan for that calendar year where you pay equal payments so that when you pick up your drugs, you don't have big costs until you reach that $2,000. There are other things that you need to know about your prescription drug coverage. Your out-of-pocket costs, again, 2025 would be $2,000. There's pharmacy networks, right? Certain pharmacies that you're going to be able to go to when you're on your United Healthcare plan, all right? Us as agents will help you navigate through which pharmacy fits in that particular plan. And then there's a drug formulary. Are my drugs covered? We check that for you as well, or you can check that on your own to find out if your drugs are covered in the plan that you are interested in enrolling in. And then here are your tiers. We talked about tiers. You have tier 1 through tier 5. And depending on your tiers will determine the cost of your drugs. Tier 1 being your preferred generic drugs are typically the least expensive in most cases. A lot of times there's a zero copay for you once you're in the initial stage at tier 1, and they go up from there. There's a lot of times there's also advantages to using mail order. Step therapy. In this case, the plan may ask that you take a less expensive drug, all right? And then if that does not work for you, the plan can step up to a more expensive drugs. That's hence step therapy. And then there's quantity limits. So if you're on a narcotic or you're on a drug that could be dangerous, the plan may ask that you that they have quantity limits for that particular drug. You may have prior authorization. Now, prior authorization will be the plan asking for more information to confirm that the drug is being used correctly. You may have formulary and utilization exceptions. You may add, your doctor might say, hey, this drug is not normally covered. I understand that, but can we get a formulary exception for my patient? So you can ask your doctor can ask the plan for a formulary exception. And then you can also ask for a utilization exception, meaning that maybe the plan has limited that particular drug. Maybe it's a narcotic or something, and the plan is thinking, hey, instead of a 30-day supply, we need to give this guy a 10-day. Well, your doctor can ask for a utilization exception so that you get more of that drug per month. In the coverage decision timeline, when you have to get an authorization, is typically about 72 hours, but you can ask to have that expedited. Your doctor can ask to have that sped up or expedited. All right, let's talk about the plan benefits of the AARP Medicare Advantage Extras from United Healthcare. It's the UHC AZ5 HMO. This is a fantastic plan going into 2025. This is just some highlighted benefits of this particular plan. Zero monthly premium, $4,000 for covered dental services. You will receive a $100 credit a quarter for over-the-counter products that you can pick up at your pharmacy. You're talking about things like vitamins, blood pressure cuffs, scales, creams, and things like that. They'll give you a $100 credit for these things per quarter. A $300 eyewear allowance, and you also get eye exams, free gym membership, no provider referrals in your local network, zero copays for tier 1 prescriptions, zero copay for primary care visits, zero copay, copays as low as $99 for hearing aids, and rewards for healthy activities. Now, as your trusted agent, we have a fiduciary duty to find the plan that makes the most sense for you. Having an advisor help you with your options is super, super critical. You don't have to, but can you imagine being able to speak to someone who can actually compare plans, make sure your doctors are in network, check your prescriptions, answer any questions you may have about any particular benefit. And going forward, once we get you on the plan, you are now in our book of business, and you can call us at any given time, and we can help you through any problems and going forward into years going forward. I mean, it's a fantastic idea to reach out to a agent, and we would definitely love to help you. Why United Healthcare? Reasons to choose United Healthcare. 4 out of 5 members would recommend United Healthcare Medicare Advantage to friends and family. They have over 45 years of excellence. United Healthcare is a fantastic program. And their Medicare Advantage program is the largest national provider network. In some cases, I've put 2 or 3 different networks, stacked them on top of each other, and United Healthcare is still a thicker network. I mean, in terms of their provider book, I mean, they're just a fantastic program. Doctors are most likely going to be in network, but agents will check and we'll figure out, and we'll make sure of that. So thank you so much for listening in. Please consider us for your agent of choice to help you navigate through the wonderful world of Medicare. And until we hear from you again, take care.